There are 360,000 registered voters in the city of Milwaukee, another 100,000 people who are eligible to vote.
It is our hope and our wish that every citizen in Milwaukee exercise this right, and that is their right to vote.
The state of Wisconsin has made it quite easy for you to vote. You should register before each primary or election if possible. That can be done in person or by mail. But in Wisconsin, you can register at the polling place on Election Day with proof of identification and proof of residence.
In other states, you have to register 90 days, 120 days, so on and so forth before the election. And the state of Wisconsin, our laws allow a person to come into the state, and if they've lived here for 10 days, they can register and they can vote.
If you have access to a computer, including those at our public libraries, you can take a look at the Election Commission's page on the city's website. If the website is not an option for you, the Election Commission has prepared a number of pamphlets on the voting process. And you can always call them at 286-VOTE with any questions. If you'd like to become a bit more involved, you could also work at the polls on Election Day.
We will be hiring approximately 1,500 inspectors to work on Election Day. That does include registrars. And we have a list of individuals who have worked for us in the past as Election Day inspectors. However, we are always in need for more inspectors. If you're interested in working at the polls, you can just simply contact our office.
Election inspectors can help with any problem that might occur while you vote. You'll find that the process for the year 2000 elections hasn't changed all that much.
Once they arrive at the polling place, of course, they will be checked off the polling list by the Election Day inspectors and then given a ballot where they can go to a booth and vote privately.
The voting machines you'll be using this year are familiar. They've been in use in Milwaukee since the spring of 1997. You'll know your vote has been tabulated when the number changes.
They are mark-sensitive ballot, meaning that once you use the number 2 pencil that is provided at the polling locations in the booths, that you mark the candidate of your choice, insert the ballot into our Optec 3P Eagle machines. Be sure that you do not leave your machine before your ballot stays inside the system. Sometimes, for some reason, the ballot will spit out, but it will always be recorded and able to be read here by the Election Day inspector as well as the voter that your ballot was rejected for. You may have overvoted, you may not have marked heavy enough, and it may not have recorded, and therefore it will record it as a blank ballot. If the machine cannot read it, it will print out and alert you, the voter, and alert the Election Day inspector that the ballot for some reason cannot be read, and then you will have the opportunity to complete another ballot.
Election officials emphasize that every vote is important. Elections in Milwaukee in the past have been decided by less than 10 votes.
Voting is so important, and sometimes people take it for granted, and we have to remember that this is your voice. Your vote is your voice, and it is a silent voice. However, it's the loudest voice that you have, and it's real important that you exercise it.
And to be prepared to exercise that right and responsibility, check on the information available from the Milwaukee Election Commission. And once you've voted, the Election Commission will also help you keep track of who's winning, providing updated election results on its website the day of the election. The Bureau of Laboratories is located in the Zeidler Municipal Building. While health threats and technology have changed dramatically over 125 years, the focus in the new state-of-the-art labs, protecting the public health, has not changed.
What it translates into for our city, 125 years ago, when 1 child out of 5 died by the 5th birthday, we're now talking about enormous improvements in survival. We're talking about clean water, clean food, and rates of tuberculosis and other illnesses that our forebears in this department couldn't have dreamed of. And the laboratory is an important part of that.
Early health threats included contamination from milk, which many people got from street vendors. Sanitary officers kept those who were sick with mumps and other contagious diseases away from the general public. The health department was an early advocate of vaccinations during smallpox epidemics. The lab scope expanded over the years, and by the 1950s was one of the first in the nation to investigate viral diseases. There are 3 divisions in the Bureau of Laboratories. They receive over 100,000 specimens and perform over 300,000 tests annually.
Testing the purity and goodness of our commercial products and the things we rely on. There's analyzing clinical specimens from patients to find out if there's a public health problem going around. Today, a lot of our work is in sexually transmitted diseases, for example. And finally, there's the whole area of environmental testing.
We do this in the context of a public health infrastructure with inspectors, food inspectors, industrial hygienists, and respond to the problems of the community in terms of public health testing. No one else addresses that particular constituency.
You may be most familiar with the lab's virology division. In 1998, technicians isolated over 1,500 viruses.
Part of that includes our influenza monitoring program, where we're able to monitor when the influenza starts in the community, what type of influenza it is, and notify the medical community. We also detect other viral trends in the community. If they're enteric viruses, such as enterovirus, which we have in the summer, that can cause not only gastrointestinal or stomach upset, but it can cause encephalitis, and we monitor that. In the winter, we also monitor respiratory syncytial virus, a very serious viral respiratory disease of children. We perform HIV testing, which is funded by the state, I should add, and in a recent year, we tested over 6,000 serums for HIV, and found in a ballpark of 1% were positive.
The microbiology division includes a waterborne pathogens lab, which tests for cryptosporidium in our water. The lab is now an international leader in detection and diagnosis of waterborne viruses.
And we do several kinds of testing here. We do syphilis testing here, where we tested over 12,000 tests in a recent year. In this particular section, we do environmental microbiology, where the food inspectors go out and every week they pull retail dairy products off the shelf and bring them in here so we can check the bacterial counts. And if they're elevated, then the inspectors can go into these establishments and have corrective actions done based on these lab findings. So that's done on a regular basis, and I'm not sure the public may not even be aware of that, but that's one example of what public health does to prevent disease with some of these activities.
In 1999, a domestic terrorism exercise was held in Milwaukee to train emergency responders for terrorist attacks. The health department is being prepared to respond to biological terrorism events.
Part of that work would be done here in our new TB facility, because it's designed with higher safety standards than the rest of the lab due to the infectious nature of tuberculosis. We now are able to test tuberculosis with the newer technology that gives us much more rapid turnaround time. We can, if we have a positive result, we can turn that around in 10 days. Formerly, it was 3 to 4 weeks, which obviously is a real problem in terms of treatment and exposure for others.
The chemistry division is the lab responsible for testing of hazardous materials such as asbestos and lead. There were 5,000 tests in 1998 to test for lead poisoning in children.
And we're able to diagnose children with lead poisoning here, give that information to public health nurses, who then go out and intervene and remove those children from risk. We also do environmental lead testing, and for example, in 1998, we did over 8,000 environmental lead tests, where we go in, the health department has staff that goes in and tests the home to see if it's contaminated, and then removes the lead and monitor, and then we monitor their progress, and once it's considered lead safe, then the families can move back in.
The health department labs are part of national networks monitoring viruses, influenza, E. coli, and tuberculosis. The labs also do contract work for other labs, clinics, and hospitals, and testing fees have raised nearly $500,000 for the city. Times and technology have changed dramatically since the labs were established 125 years ago, and that will continue with the evolving needs of public health.
Take a much closer look at recreational water now. We take a closer look for example, drinking water. We do a lot of cryptosporidium testing and waterborne pathogen testing now. We also are looking at what are called emerging pathogens. Whooping cough is making somewhat of a comeback. It hasn't gone away. Tuberculosis has made a comeback, and some of the strains are resistant to antibiotics. We need to be on the alert for that. The times are changing, and the laboratory is here to evolve with those changes and respond accordingly.
What it basically means is more confidence in the food you eat, more confidence in the water you drink, more confidence that the people around you who may have communicable diseases, they are detected and treated in a timely manner.
The Sherman Park poster depicts the characteristic Milwaukee bungalow found throughout the neighborhood. You will, of course, find a variety of other housing styles here as well. Residential development began around 1900 in the southeastern corner along the railroad corridor, where industries provided jobs for many of the new residents. Dozens of churches followed, including St. Anne's at 36th and Wright in 1894. Grant and Sherman Boulevards, named for Civil War heroes, became the area's most prestigious addresses as the neighborhood grew. Not all agree on the boundaries, but the Sherman Park neighborhood, home to some 40,000 people, generally runs from 30th to 60th Streets, from North Avenue to Capitol Drive.
I think if you ask people in Sherman Park, their perception of Sherman Park, they would say it's a warm, neighborly community. A community made up of constituents, black, white, old, young, that come together on behalf of their community.
Gary Callis is a resident of Sherman Park. The association he heads is Milwaukee's largest community organization, formed 29 years ago to fight a freeway and racial steering.
Those were the types of issues that the whole community was aware of because the media saw it as something that they would certainly cover. It was important issues, a lot of people involved. But on a day-to-day basis, we help people do community cleanups, do block clubs, and bring people together.
Activity at the intersection of Sherman and Capitol is the issue that brought them together recently. Residents complained a 24-hour gas station was a magnet for troublemakers. Barry Givens has lived near the intersection for 17 years.
There's a sense in this area or in this community that people care about people. As a community, in order to try and maintain the serenity and the quality of life in our area, people have come together in order to try and work out some sort of resolution to eliminate the problem.
The park the neighborhood is named after was once known as Perigo Park, after its previous owners. It was purchased by the city in 1891, before the area was even in the city limits. The blues festival Sherman Fest is one way the area celebrates its diversity. Another is with a calendar of residents.
Sherman Park has long lifted up a celebration of people, celebration of diversity. It's more than just tolerance among many of the leadership in Sherman Park. It's about celebrating the people who live in Sherman Park, and that means all people. Whether it's a growing Jewish population in parts of Sherman Park now, or certainly an African-American population, Sherman Park has long been a community that has celebrated diversity of its residents.
The association, businesses, residents, and the city are working to do things that will impact the neighborhood in a positive way. A community learning center at Washington High School offers classes which aim to strengthen families and the neighborhood. The Sherman Park newspaper reaches thousands of people with reports on neighborhood issues and events. Staff take part in housing surveys to check on building code violations. They form block clubs. A volunteer citizen crime patrol program has operated since 1991. Neighborhood challenges include maintaining the housing stock and retaining owner-occupants.
Many residents that have been here 15, 20, 25 years, they have a sense of pride. They want, you know, they want to cut their grass. They want to make sure that the litter doesn't get out of control. You know, it's those types of things that, you know, I think everybody that I've encountered has really taken an active part in trying to maintain the neighborhood.
There's certainly sections of Sherman Park where some of the housing has fallen into disrepair. It's small sections. Overwhelmingly, the neighborhood has still a remarkable housing stock. There are houses that are certainly in demand right now. You know, property values are on a significant increase of late in large sections of Sherman Park. We're happy with that. We think bringing folks together over the years has had certainly an impact on that particular outcome, which is a positive outcome for our community, and we look forward to the future of doing even a better job.
One area of Sherman Park is still under construction. In the late 1960s, a block-wide belt of homes just above North Avenue was cleared for construction of the Park West Freeway. In 1978, freeway authorities released that land for development. Sherman Park was once described as an urban experiment in cultural diversity. It's a description many believe still applies.
Sherman Park for years has stood as a beacon almost to say that people and their attitudes about race are misguided, and that people can come together. And I'd like to think that we're going to continue lifting up that message, certainly celebrating our community, and we certainly invite everybody to join in the party.
Sure, we have problems just as any neighborhood would. However, I think again, the stability, the fact that there's diversity, there's pride from the residents, and I think as long as those types of things exist, the neighborhood will continue to thrive.
Eight-year-old Larry Rimmer needed eyeglasses recently, but his mother didn't have the health insurance that would help pay for the eye examination or glasses. But Larry and his 3-year-old sister Brandy now have the insurance coverage they need because of BadgerCare, an extension of the federal Medicaid program.
What it does is it extends the entitlement of Medicaid to working families. So families can have assets such as a house and a car and work at a livable wage and still qualify for health insurance. Also, I think that the biggest misconception of BadgerCare is, in most entitlement programs, is that people who are working don't qualify for programs. You have to be the poorest of the poor, or you have to be on a W-2 or some pay-per-performance program to qualify, and you don't.
After 11 years of working in a nursing home, Pamela Rimmer was starting a new job with no health insurance. While preparing to start the job, she found out that medical assistance was available for low-income working families through BadgerCare.
I didn't have any insurance, and I was starting a new job, and I need to have a skin test done. So I went over. They referred me to a place to go to have the skin test done, and I went there, and when I filled out my paper, I put on it that I didn't have any insurance. And the lady came and she spoke with me about the program BadgerCare and let me know what I needed to do about getting BadgerCare. And when I took those steps, it didn't work out at first, but I called her back and she helped me, you know, take the right steps in getting BadgerCare.
Well, what the county has done, the Department of Human Services, they have set up outstations throughout the city. There's over 30 locations where you can apply. You no longer have to go to 12th and Valete, 9th and Mitchell and stand in a line. You can call any of the 30 outstations, and most of them have evening hours and some have Saturday hours where you can go and actually apply. Well, they ask them usually for vital pieces of information, income, verification, residency verification where they live, make sure they live within the county, birth certificates for the children in the family and the members of the household who they're applying for, and also Social Security numbers. So usually those are the 4 vital pieces of information. Most times the appointment usually takes a half an hour to 45 minutes depending on the application and how many members in the family. They usually can tell them before they leave if they're eligible or not.
BadgerCare's comprehensive coverage includes immunizations, hospital and doctor bills, dental work, drug prescriptions, eyeglasses, and many other needs. There could be no cost for those meeting poverty guidelines. Above the premium-free levels, families pay 3% of family income. There is no asset limit for BadgerCare.
I think that most people may be a little hesitant about it because they think they may make too much money or they don't qualify because they're not on a W-2 program. And I think that, once again, that's probably the biggest misconception, that you do not have to be on a W-2 program to qualify for BadgerCare, food stamps, or child care. So I think if that message gets out, people would apply more freely.
In addition to caring for her own children, Pamela Rimmer is also a certified child care provider, working out of her home. It's another job that doesn't provide health insurance, and with BadgerCare, she doesn't have to neglect her health or that of her children.
Well, I have insurance. I didn't have insurance at first. It's a big monkey off your back to, in case if something happened, emergency happened, I do have some kind of insurance coverage, which is before I didn't, and I would have to come out of my pocket, which I was stuck with a lot of bills before, but I paid them.
Outreach workers say eligible families can be 1- or 2-parent households without health insurance and must have children under age 19 living with them.
I think that prevention is probably least expensive, but it also, helps, especially with the smaller children, to be able to participate in, say, school sports and things like that, because most parents don't allow children to participate in school sports and other outings because they're not covered. They have to have health insurance to participate. And this is another way of, it's just health insurance. It's no different than a regular HMO, and people probably don't understand that.
What would you say to other people about the BadgerCare program?
It's a good program. When lots of your workers, the steps that you take and you're not qualified for it, that the workers should let you know about the BadgerCare program, because it's a good program for the people that's not being qualified for the medical assistance. And 9 times out of 10, you'll be qualified for the BadgerCare. It's a good program, especially if you don't have insurance. We all need some kind of insurance coverage.